Tummy tucks and liposuction are both procedures designed for contouring, but we have to look at what each one can accomplish. So let me use my fingers as an example for kind of the layers of tissue. So we have our skin, we have our fat, then we have our muscle layer, and then below that we have our, for the abdomen, our intestines and all that kind of stuff. So within this, there are several factors that we look at. Do we have extra loose skin? How much extra fat do we have? What is the condition of the muscle layer? And then also when we're talking about the trunk and torso, how much extra fat do we have around our viscera or our internal organs? So if somebody has good skin, good muscle, but this fatty layer is overly pronounced, and some people call that the pinchable fat or the fat you can grab, then you're going to be a fantastic candidate for liposuction. But if you also have loose skin, or from pregnancy, if you've had laxity of the muscle layer, just doing liposuction isn't going to correct that. And in fact, it might exacerbate loose skin. So we want to put that together. So if you're in that scenario where there's loose skin, if there's muscle weakness, regardless of what's going on with the fat layer, then something like a tummy tuck is going to come into play. But they are synergistic, they work together. So if you have loose skin, extra fat, and some loose muscle, then we're going to do liposuction and a tummy tuck. Now, the one piece of that comes out that's a little different is somebody who, like my grandpa, normal skin, not a whole lot of pinchy fat, but then he had this big belly, all right? We used to call that the watermelon belly, right? You can just poke at it, it's like ding, 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 ding. That's somebody who's accumulating a lot of fat inside, and that's a genetic pattern, more common in men than women, but there are women who have that. And in that scenario, you're not going to be a candidate for liposuction, or probably even for a tummy tuck, or not a traditional tummy tuck at least. And it's really more of a weight loss process to get that to shrink down. Then we can look at what's left on the outside.